what can you tell us about Nevimaze and how you guys have been dealing with the present pandemic?
We founded Nevimaze really as a patient experience platform. So as you mentioned, I'm a physician. I've been in practice for a long time. Over the years in my practice, I always ran behind schedule. Over the years, it's become kind of even more important to not keep patients waiting. Now with CAP scores and patient satisfaction scores being linked to reimbursement and online reviews, when patients wait, they don't just share it with one friend, they share it with the world. So we really found Nevimaze to solve that problem. And we built a platform that integrates easily with electronic medical records. It tracks patient flow, it predicts delays, and then it text messages patients in real time to let them know when the practice or the doctor's running behind schedule. Now, in the current pandemic, we've seen a lot of practices move to telehealth. So there's a couple of things we've done. One is we've helped practices who've pivoted to telehealth and whose patients are, online. It's a new experience for them. We help message their patients to let them know the doctor's still there, wait in the virtual waiting room, let them know when the doctor will be with them so they don't just log off and get frustrated and think that that's not working. So that's one thing. The other thing we've done is really adapt our platform to help practices that are still seeing patients in person implement social distancing in their waiting rooms.
What do you see as the longstanding effects even beyond this pandemic for, what does that look like in 5 years, 10 years?
Yeah, so I think that there are a lot of things in healthcare that we're going to see change after this pandemic. I mean, it's been really fascinating to see how quickly the industry as a whole has adopted telemedicine really almost universally across the country, right? I think there are a number of reasons for that, right? I think that the rollback of all the regulation, the institution of pay parity, the removal of HIPAA as a barrier for telemedicine adoption, all of that has really enabled physicians to be able to communicate very smoothly and seamlessly with their patients. And I think we're seeing the benefits of that.
Well, one last question for you. As a physician and an entrepreneur, what do you think is or has been the biggest learning for you that has come out of this tragic pandemic?
The amazing thing is the resilience of the patients, I would say, to adapting to new environments and new realities. So there's been so much push like, we're not going to adopt telemedicine, our patients won't tolerate it. The patients, they're doing what they have to do, and they're amazing. So I think that's one thing. I think the other thing is that the kind of aha that you can really adopt technologies quickly in healthcare.
Well, Dr. Meller, thank you so much for taking the time to sit with us today. And equally as importantly, thank you for all that you do for patients and for us. I know this is not an easy time to be a physician in New York City. And you and those like you are extremely brave, and we are all very grateful for what you do. So thank you.
Well, thank you for your kind words, and thanks for having me on the show.